before we get into some of the nitty-gritty pieces of bone tissue, I wanted to make sure we were clear on the four bone cell types. So there are three that come from the same lineage and one that comes from a separate lineage. So I want to start with the same lineage and then build from there. So the first cell within the same lineage is referred to as an osteogenic cell or an osteoprogenitor cell. This is what a type of stem cell. And so when I say stem cell, I mean that it's a cell that is immature and will grow into other cell types. I'm not saying this is the same as an embryonic stem cell, which can go into many different types. This particular osteogenic cell is able to become bone cells primarily. The bone cell that it typically develops into next, so the second of our bone cells that we're talking about today, is an osteoblast. Osteoblasts are, again, still a little immature. They aren't doing all of the functions of a fully mature bone cell, but they are what develops first as a bone is growing, as a bone is healing, as a bone is developing. So this bone cell type lays down what we refer to as osteoid, or the organic components of my bone. So the collagen and some of the other squishy things, the things that are associated with carbon. These bone cells eventually mature into what we refer to, the third cell type, as osteocytes. Osteocytes are the mature bone cells that we see that are able to monitor the tissue. They are able to regulate the calcium. They're able to provide the structure and tension, but they are not building new bone in the same way the osteoblasts are building new bone. They're not laying down new organic structure to be calcified, but rather they are regulating the calcium and maintaining the tissue as a whole. The fourth cell type is not from the same lineage. So what that means is that it had different stem cells, different precursors that got to where it is. These are called osteoclasts. The osteoclasts come from the immune background. So if you think about immune, you think about things that break other stuff down, right? Breaking down pathogens. And so these osteoclasts break down bone tissue. This is not to destroy it, but rather for it to be remodeled, whether that's for healing purposes or for regulating the calcium in our bloodstream. It's supposed to be naturally breaking down and then building back up. So we'll use osteoclasts to break down, osteoblasts to build up. Anyway, I want to make sure this is clear before we went through the physiology of things like bone development and bone growth.